Let's look at the steps needed to administer an IV push using the BD Facile system. For each dose, you'll need one BD Facile connector or a BD Facile Y-site, regardless of whether multiple drugs or doses are anticipated. You'll also need a prepared BD Facile syringe unit. Ensure all Luer lock connections are securely tightened. Luer lock a BD Facile connector onto the patient's IV line or access port according to your facility's protocol. Or access the connector on a BD Facile Y-site. Engage the prepared syringe unit to the BD Facile connector or Y-site connector using the push-turn-push technique. The port is now ready for administration. Be sure to hold the BD Facile connector or Y-site connector while administering the drug. When the IV push administration is complete, disengage the BD Facile syringe unit from the connector or Y-site connector using the pull-turn-pull technique. If required, the next BD Facile prepared syringe unit or IV infusion can now be administered through the same BD Facile connector or Y-site connector. The BD Facile connector or Y-site should remain connected to the IV line and should be discarded intact when the tubing is removed or changed.